It's Camila Cabello in Havana at 8:40 on the early show. Your weather details are standing by. We're going to get to that in just a second. But we have some special guests in the studio this morning.
Yes, you do.
Claudette, good morning.
Good morning, Nick.
Good morning, Chris Etcheverry.
Good morning, Nick.
It's great to have you both here. Now, when these two people show up in our studio, you know that it's for the Battleford Union Hospital. You guys are synonymous with that, just so you know. So,
thanks.
It's a good thing. It's a very good thing. And we've got a big thing, a very good thing that we want to tell people about today.
That's right. Well, Nick, this is kind of our official radio kickoff for our Radiothon on air for healthcare, which will be happening on Friday, May the 11th. And it's for a very important cause. It's to purchase a new central cardiac telemetry system, and that's why Chris Etcheverry is here today.
Yeah, because that's a bunch of big words. Chris, what does that mean? Can you make that sound like English?
I'll make it really simple for all our listeners out this morning. So essentially in ECGs, it's just a diagnostic tool that measures a patient's heart electrical rhythms, okay? So, I mean, traditionally, this equipment, you know, patients had to lay in a bed, they were hooked up to a machine on the wall, they weren't free to roam the hospital, and they had to be admitted into the ICU or the ER. Okay. Only two places. And,
very small amount of beds in those places, right?
That's right.
Okay, all right.
Very small, and we try to keep the sickest of the sick patients in those areas. And, you know, over 10 years ago, telemetry began, and people wonder, what is telemetry? Well, you know, it's a little pack with wires, and it hooks to a person's chest, and it monitors their cardiac rhythm. Okay. And everyone has wireless in their home. Wireless internet, wireless
Wi-Fi everywhere.
Guess what? These machines are wireless as well.
Nice.
And we have access control points located on the walls all around Battleford Union Hospital. And what this allows patients to do is to walk freely around Battleford Union Hospital, and we can still monitor their cardiac rhythm from the intensive care unit.
Wow,
okay? Cool. So, like any equipment, you know, our current system is over 10 years old, and it's getting outdated, and it's getting more difficult to find, you know, replacement parts for it. Yeah. And so, hence, you know, this year's third annual Radiothon, that's what we're trying to accomplish, is raise funds for our campaign. We don't want to miss a beat.
That's right.
And you know, I just wanted to give some people some statistics, because you know, this isn't just equipment that, you know, we use on, say, a dozen patients a year. We have 1,600 patients every year at Battleford Union Hospital that utilize telemetry monitoring. And you know, what does that mean? Well, 2.4 million Canadians, all right, suffer from cardiac related disease. That's 1 in 5 people.
1 in 5?
1 in 5 people. And it is the second leading cause of death in Canada. You know, next to cancer, is the second leading cause of death. So, you know, I don't think we'll have to look far, whether it's our family, perhaps, or even our children. This equipment is the lifeline to monitoring people's hearts. Not only that, but this new system, we can now monitor their respiratory rates and their oxygen levels in their blood.
That's cool. All at once, eh?
This is all at once, and you know what? We can admit patients now on any floor with this equipment. You don't have to be in the ICU or the ER necessarily.
Nice.
And you know, it's a fantastic opportunity for us. You know, over 5 years ago, we upgraded some of this equipment, and we were the first hospital in the province of Saskatchewan to do that. Wow. And when people like stars would come to the ER, they looked at our equipment and they said, wow, you guys are the only ones that have this.
That's cool.
So, you know what? It's nice to stand out on the map.
No kidding, right?
Battlefords and community have been very, very generous over the years to the Battlefords Union Hospital Foundation. And in turn, you know what that does? It helps each one of us out, our families, our children. Right? That's what this is all about.
Exactly. All of this is coming back to us in the form of great health care, and we want the best of the best for us, for our family, for our friends. Now, Claudette, in order to pay for this, we got to raise the funds, and that's what On Air for Healthcare is all about. Q98, CJNB The Rock, and our sponsorship partner, Fisher's Drugstore, happy to step up and do this again this year, because like Chris said, 1 in 5 people are going to be affected by cardiac disease. So let's get going. How do we raise these funds?
Well, there's a number of things that you can do. This year we're introducing the I Care for Healthcare mics.
Oh, yes.
Right, that card, you write your name on it, you give us a toonie, your name goes up on the wall.
And we're going to plaster the lobby with those things.
We are doing that now. And we're going to have it out in a number of grocery stores and auto dealerships. Fisher's Drugstore, of course, is going to have them. And there's other ways. For instance, Crazy Cones, Heather McGuire, right? She has said to me, Claudette, I'm going to donate a portion of every sale that I make today. Every ice cream cone is nice, right?
That's
so
great.
Other businesses can do that. You can do things like Carrie Tolson's daughter last year took a portion of her tips that she made at Country Cuisine,
that was cool.
right?
Yeah.
And donated it. So there's ways that you can do this and assist and keep it local and enrich healthcare that's not really making a big hole in your pocket.
Yeah.
Most businesses have a dress down day. Consider donating a portion of that to us. Some people give a donation on honor in memory of somebody. Or,
That's
for
true, yeah.
instance, Peg Monula, she donated so much in honor of each one of her grandchildren.
That's cool.
I
yeah.
know, very, very cool.
We want to see more of that. We want to see everybody getting involved and stepping up and realizing that this is a really important thing. It's going to affect a lot of people. It's going to improve our healthcare, and it's real easy to give. One thing that I heard about a fundraiser once upon a time, this is a very long time ago, but a really wise guy said to me, it's really cool when you have the ability to give, so that when you wake up in the morning and look in the mirror, you can think, wow, I can't believe I gave away that much money. But you just feel so good about it. You know that you're affecting so many people, and it's because of what you can do.
That's right, and the other cool thing is, Nick, is on Air for Healthcare Day on Friday, May the 11th. Come and see us,
Yeah, you
right?
bet.
We want to get you on the air and tell us about how you raise this money and with your organization or your school group, because we got great students out there.
That's
And
for
it's
sure.
not just the Battlefords; it's the surrounding area. We're a huge catchment area for BUH, and we would love to see you. We would love to know how you've raised the money, and we'd love you to help us out.
Excellent. Well, we're looking forward to it. May 11th is going to be here before you know it. Make sure to put it on your calendar. Talk with your loved ones. Talk with your coworkers and everybody else that you know about how you're going to give and how we're going to install a brand new cardiac telemetry unit. Did I get it right?
You got it.
Yeah!
That's right.
So give us a call, 306-446-6652, and we can show you how you can help us out.
Check them out online as well. BUHfoundation.com. Claudette, Chris, thanks so much for joining us.
Nick.
You bet. Thank you.